Hey everyone, Dr. Mike here. Have you ever witnessed someone having a seizure and didn't know what to do? It can be a scary experience, right? Today we're going to learn about epilepsy, a common neurological disorder that is still widely misunderstood. Epilepsy affects millions of people worldwide, and it's important to remember that people with epilepsy can live full and active lives with the right treatment and support. So, whether you're familiar with epilepsy or just curious to learn more, stick around because we're going to break it down in a way that's easy to understand. Let's get started. Epilepsy is a chronic neurological disorder that causes seizures due to abnormal electrical activity in the brain. Imagine your brain's electrical system having a sudden surge or disruption. That's what happens during a seizure. This doesn't mean that people with epilepsy always have seizures. There can be many different manifestations. Some people experience frequent seizures, while others have them very rarely. It's also important to note that not all seizures are the same. There are different types, and the severity can vary greatly. Some seizures might involve convulsions, while others might cause a brief lapse in awareness. The key takeaway here is that epilepsy is a spectrum disorder, and each person's experience is unique. So, what causes epilepsy? Well, it's not always easy to pinpoint the exact cause, but there are several factors that can play a role. Genetic predisposition is one factor. If someone in your family has epilepsy, your risk of developing it might be slightly higher. Brain injury is another potential cause. This could be due to accidents, strokes, or infections that affect the brain. Brain development abnormalities can also lead to epilepsy. These abnormalities might be present from birth or develop early in life. Metabolic disorders such as lack of oxygen or low blood sugar can also trigger seizures in some cases. Now let's talk about the symptoms of epilepsy. As I mentioned earlier, not all seizures are the same. Some common symptoms include generalized seizures. These seizures affect both sides of the brain and often involve a loss of consciousness and strong convulsions. Focal seizures. These seizures originate in one part of the brain and might cause twitching or unusual sensations in a specific part of the body. Absent seizures. These seizures are characterized by staring spells and brief losses of consciousness. They are more common in children. Aura. Some people experience an aura before a seizure. This is a warning sign that can manifest as a strange sensation, vision changes, or an unusual smell. Diagnosing epilepsy usually involves a combination of tests and evaluations. One of the most common tests is an EEG or electroencephalogram. This test measures the electrical activity in the brain and can help identify seizure patterns. MRI or CT scans might also be used to look for any structural abnormalities in the brain, such as tumors or areas of damage. Blood tests can help rule out other conditions that might be causing the seizures. Treatment for epilepsy typically involves medication, and thankfully, there are many effective anti-epileptic drugs available. In some cases, surgery might be an option to remove the area of the brain that is causing the seizures. Vagus nerve stimulation, which involves implanting a device that sends electrical impulses to the brain, is another treatment option. And believe it or not, even dietary changes, such as the ketogenic diet, have shown promise in managing epilepsy. It's important to remember that treatment plans are individualized and what works for one person might not work for another. It's crucial to work closely with a healthcare professional to determine the best course of action. Now let's talk about what to do if you witness someone having a seizure. It's natural to feel scared or helpless in such a situation, but it's important to stay calm and take the following steps. First and foremost, try to prevent any injuries. Gently guide the person to the floor if they are standing, and clear the area around them to prevent them from hitting anything. Place something soft, like a pillow or a jacket, under their head to cushion it. Do not try to restrain them or put anything in their mouth. Contrary to popular belief, people don't swallow their tongues during seizures, and trying to force something into their mouth can cause more harm than good. Time the seizure. If it lasts for more than 5 minutes or if the person experiences multiple seizures in a row, call emergency services immediately. Once the seizure subsides, gently roll the person onto their side to help them breathe easier. Stay with them until they are fully conscious and offer reassurance. Epilepsy isn't as scary as many people think. Understanding the condition helps us have the right attitude and better support those affected. Remember that people with epilepsy are just like everyone else, and they deserve to live their lives to the fullest without stigma or discrimination. If you found this video helpful, please like, share, and subscribe to our channel for more useful health information.